Good morning, everyone, and welcome to this special legal compliance COVID webinar session that our law firm Kaizen Synergy is running. My name is Nihal Samara. I'm the General Counsel and Legal Director here at Kaizen Synergy Law Firm, and I'd like to welcome you all to today's session. Today's session is actually a special view that we are running on what would happen if your suburb where your agency is located in suddenly became a hotspot. What would you do? How would you be sure that your staff are kept safe, that you're adequately screening relevant people, that you're communicating and making information available to staff, and what are the processes and systems that you actually have in order to do it? And in fact, is your agency ready? We have a situation currently unfolding in Victoria where we are actually going to use a case study to show what has been done and what systems have actually and processes have actually been put in place some time ago. And as this continues to unfold, what things people have actually done and how quickly things have changed during this time as well too. What we hope to give you at the end of this session is the tools, resources, and sharing of information around some of the strategies that have been put in place and that continue to be used as well. So when we look at, just to put this immediately into context of how quickly things can change, we can see that going back to the September the 21st to 23rd, basically a Frankston cleaner goes to work at the Butcher Club at Chadstone Shopping Centre, which is a major shopping hub in Victoria. And at that time, she's unaware that she's contracted COVID-19 from a family member. By the 24th of September, a day later, the cleaner calls in sick. On the 25th, the cleaner gets tested for COVID-19. On the 26th, the cleaner returns a positive test result. She does not tell contact tracers that she's worked at the Butcher Club during this time. Now, what happens then on the 28th, the manager of the Butcher Club is admitted to hospital and returns a positive COVID-19 test. And the connection is only then made between the cleaner and the butcher. A day later, on the 29th of September, a male truck driver, the father of a man who worked at the Butcher Club, travelled to regional Victoria for work. He stays overnight in Kilmore at a private residence. And then on the September the 30th, the Butcher Club cluster is first mentioned in the Department of Health and Human Services daily media release. So you can see already that there's a week gap between the date that the initial issue has come up with the person simply travelling to the date that the media release was made by the State Health Department. On this date, the truck driver stops at a cafe in Kilmore for breakfast between 7 a.m. and 10 a.m. in a breach of lockdown rules. Now, in Victoria, we've had significant lockdown restrictions in place, and this just demonstrates just how quickly things can actually change. He then travels to Shepparton and then on to Benalla, and what is then seen on October the 1st, 8 cases are linked to the Butcher Club outbreak. The truck driver begins showing COVID-19 symptoms, and it's only then that is tested. By the 2nd of October, we have 11 cases that are now linked to the Butcher Club outbreak. At this time, the truck driver returns a positive test. He doesn't tell contact tracers about his visit to Shepparton. And then essentially on the 4th of October, 20 cases are linked to the Butcher Club outbreak. The cafe in Kilmore is listed as a high-risk location by the department. Subsequently, on the 5th of October, 24 cases are now linked to the Butcher Club. A worker at the cafe tests positive to COVID-19 and then infects 5 other people. And then 7th of October, what we see is 31 cases linked to the Butcher Club. The cluster is deemed contained by the department at this stage. But then what happens between the 10th, 13th and 15th, we suddenly see an escalation of cases. And currently a total of 15 people have been infected from the start of this outbreak, and 32 are still fighting the virus. So you can see essentially that within 24 hours, how quickly one person's actions can infect and spread the virus. Now, what this raises is, for agencies like yourselves, what are the systems, what are the processes, and are we in fact ready should this occur? What this demonstrates at the moment here in Victoria is how quickly things can actually change. So while there are easing of lockdown restrictions, while different states and territory borders ease restrictions themselves and change, which gives a much broader ability for people to freely move, essentially one person can essentially spread this virus very, very quickly. And so what we're going to look at today is, well, what are the systems? What are the COVID safe plans? How do you trigger this to manage this process? And how do you engage staff and volunteers and community in order to ensure that you have the appropriate systems and processes in place to manage this? Before we move on, as always, we'd like to pay our respects to the elders, past and present. This session is being recorded and will be made available to all attendees, including the webinar slides that we are using today. If you do have any questions, by all means, please post these into the questions panel in front of you. I just note that Jean Mark has said good morning to all of us, and equally good morning to all of you joining us from around the country today. So today's agenda is going to look at putting the COVID safe plan in place. What does this mean? How do you do this? What are the systems in place that have actually worked for agencies based in Shepparton? What have they done? What are the processes that they've actually looked at and trigger and ramping up of screening for their staff and the likes as well? We're going to look at what is the duties of directors and officers as well too for yourselves. What is the need to actually put something like this in place? How do you do it very, very simply? As well as what are the operational considerations that you need to have as well too? And what is in, I'm going to say, reality at the moment, what is actually working? What have agencies done that actually shows, well, this is how we're managing this process at the moment as well. So essentially, as I've said, very, very quickly, you can go from 0, no cases, to 24 hours later, state health departments coming into your suburb to try and set up screening clinics, COVID testing, and support networks in order to ensure that the community and public health obligations are being met. So by attending this webinar, what we're going to look at providing to you is a timely collection of resources that you can use as well. See what COVID safe systems and activities other companies have been doing that is working and helping them to essentially manage their services throughout this pandemic period. So as I've mentioned, a couple of housekeeping items as well too. This webinar is actually being recorded all the way up to the question and answer part of the session, where we will open up the phone lines, and more than happy to stay on the line and answer any questions that you might have. Throughout the session, you can post questions in the chat panel as well too on your webinar dashboard, and all webinars are published on our Gemba 360 YouTube channel, and all materials referred to will be circulated, including these slides, to all attendees as well too. There is also a knowledge base that we have created. We've been running these webinars since February, and you can actually access these directly off our own website, where we have actually set up a knowledge base section where you can view past webinars and the likes, and also other reference and resource material as well too. If you do have any questions, you can contact us directly at our law firm number, which is listed here. My mobile number equally has also been listed on all of the webinars, and email address as well too, and more than happy for yourselves to reach out and contact us if you do have any questions. So let's actually have a look at utilizing a real life case study around what's going on in terms of systems and setups, and how agencies have dealt with this and how quickly it has come around. Just a word of introduction as well too. There are many new agencies that are joining us this morning. We have onboarded some 2,000 companies over the past few weeks with their COVID safe plan, and also access to the Gemba 360 COVID safe dashboard, which we will be showing you as well. Just briefly, our background is that our law firm is a company that I actually set up about 10 years ago. We wanted to make it different to other law firms, where rather than just providing black and white legal advice, we actually work with agencies to support them in the systems and processes that you actually have within your agency, which makes us very different, and hence our name. Kaizen Synergy actually means small incremental improvements, and synergy obviously means working with yourselves where the sum of its parts are greater than working individually. Over this time, we have got numerous awards from Aboriginal agencies for NAIDOC weeks, and also universities awards for public-private partnerships, and presented disaster systems at international conferences around, and recognised as opening guest speakers at Dubai International Emergency Disaster Management Conference after we had the swine and bird flu epidemics many years ago as well too. As part of it, our compliance systems that we do run are used now by some 6,500 agencies around the country, many of which we've actually just onboarded some 4,000 agencies just in the past few months as well too. It is the mobile dashboard that I'm going to show you is also accessible by any mobile device, and you all actually have access to it as a working option for yourselves, which I will come to as well too. So all attendees also get access to this dashboard as well. So today's agenda, we're going to look at the COVID safe plans. We're going to look at what is it? Why is it important? What is it going to do for you? How do you ramp it up during a increased hotspot in your area? What are the duties of yourselves as duties of directors and officers during this time as well too? How do you marry the legal compliance obligations that you have with actually ensuring that your staff are actually kept safe and your agency can deliver the services that it is required to do? So, as I mentioned, we will be circulating all of the resources out for you as well. I will just recognize the number of agencies as well too that have over the last few months have agreed to allow us to share resources and learnings that they have provided. Certainly Rumbalara Aboriginal Cooperative, who we will be referring to today specifically, which is actually based in the hotspot zone and is in Shepparton as well, and acknowledging Laurie Seville, the Chief Operating Officer there. In contrast, we will also reference Women's Housing Limited, Judy Line, this Chief Executive Officer, and also, who is not listed here, Lena Tompkinson, the Compliance and Executive Assistant Officer as well too, in terms of the work that they've done. So we'll actually give you some key case studies on what they've done, systems that they've actually implemented in order to manage their COVID safe compliance obligations. Why is this so popular? And there is no silly questions. So with it, we're just joined today by a huge number of agencies around the country. Just about every community service agency has jumped into this webinar. With it, there are no silly questions. If you do want to ask private questions, we will address those in the chat box here as well too, as we go through today's session. We will contain it to just under about 45 minutes, so that way it leaves some time for questions that you might have when we open up the phone lines. So let's move through. Essentially, a number of months ago, Scott Morrison, the Prime Minister, announced the three-step framework for a COVID-safe Australia. And as part of this, there was the step 1, step 2, and step 3, and the requirement for a COVID-safe plan. And this is where we're going to start with today. Essentially, the COVID-safe plan is required by all agencies, and you can see that listed here. Workplaces develop a COVID-safe plan. And the idea of this plan, when we looked at this actually back in February, was to ensure that if you ever needed to ramp up, if there was a emergency situation like we're seeing at the moment, you know what to do. There are steps to be taken in the event that you needed to look at who does what are the screenings that need to come out of this, and how do you manage and get notified if there is a case within your agency as well. One of the confusing parts of all of this is that there just seems to be so much information and not much information at all, sort of thing. And idea is, and the issue is, not idea, the issue is that there's a lot of documents from a lot of different agencies, and trying to put this together is actually very, very difficult to do. There's also everything from roadmaps to biosecurity legislation to posters to COVID-safe apps that people are saying, do I need this? How do I manage it? Can I compel staff to disclose this information? What do we need to put up? What is the three-step framework? How does it all work? So let's actually just step back and go, firstly, what is the COVID-safe plan going to do? And also, what is it meant to do for you? So across the different states and territories, the premiers often say, look, there are 4 things. The COVID-safe plan is to ensure staff are kept safe, community and service are supported and delivered. It addresses the changing business needs that you might have, and also allows people to access support and for your agency to continue to deliver services. But also, what isn't referred to, and it's also less, I'm going to say, appealing politically, is also to ensure your company meets its legal compliance obligations. Under work health and safety laws, public health laws, privacy laws, fair work laws are just a few of the things that your COVID safe plan should help you meet. Getting it wrong as well too can potentially open your agency up to class action. And let's actually see some current case of what's currently going on at the moment. We've seen failings in aged care services. There's judicial inquiries into the government's management of hotel quarantine systems themselves called for it down in Victoria as well too. So this is a very real, and not just from a public health response to COVID-19, but also for the management of your company. So having this COVID safe plan is really just important to be able to have for yourselves. Now, with it, why is it so important as well? Well, COVID-19 will be with us for some time. While premiers might look to race to open up state boundaries, there's arguments going down in Victoria about how quickly lockdowns are being eased and then restrictions are in place. But the reality is COVID-19 will be with us for some time. So it's important that your business has a plan and continues to plan to keep your workplace healthy, safe, and virus-free. Now, we've seen these slides before when we've looked at this from a planning process, and we're going to look at the ramping up of some of these systems to show, well, how do we monitor that our staff are healthy, safe, and virus-free? What is the process that we need to actually do this? Now, just before I go into that section, we do need to discuss the duties of directors and officers. And what I'm finding is that there are questions still being asked by CEOs, by boards, committees of management that you might have, even company secretaries and the likes, of saying, well, do we have a duty to actually have a COVID safe plan? Do we actually need one, really? And some of the arguments that we've heard is, well, look, we're not open. We're going to open shortly, but when we do, yes, okay, we might have one, but do we need to? Well, the reality is, as a director and officer of a company, then you need to ensure that you meet your work health and safety obligations and you comply with these obligations as well too. In relation to COVID-19, you need to take due diligence, which means you must acquire and keep your knowledge of COVID-19 situation up to date. You need to follow authoritative sources such as the Australian Government Department of Health and check for daily updates to safety advice and look at if the advice is relevant to your workplace and quickly take steps to help your employer implement it in the workplace as well. Now, this also looks at ensuring you understand your business, its work health and safety hazards and risks, and including how COVID-19 could affect your workplace and workers as well too. And there is a direction coming out of the Commonwealth to make sure that your workplace is properly resourced to manage work health and safety risks during the COVID-19 outbreak. And this was something that was put up way back in February or March this year. And so we're seeing this obligation continue. There is the planning process for some health and community service agencies that are actually looking at December as part of its timeline. And when I say December, I'm not talking about December 2020. I'm actually talking about December 2021. And that's the reality of where we're sitting at the moment. So the COVID Safe Plan itself actually needs to span and say, well, look, what is our processes that we've actually got in place? How do we bring these frameworks together around this? Now, there are a number of different industry plans. There's some plans coming out of Prime Minister and Cabinet. There's different state plans of areas of what is a plan, and they're actually quite loose documents in the past. And different states have different priorities and different sets as well too. What we have found is when we've put this together for agencies, and you'll find this within your COVID Safe dashboard, we've divided this into step 1, step 2, and step 3. The step 1's, what we've actually looked at here, is to take the Commonwealth direction. Now, since this came up a number of months ago, we've actually continued to keep it as step 1, step 2, and step 3. And I'll come to what these look like. Now, the reason that we've done that is we've actually taken the Commonwealth's approach around it. We know in different states and territories, they might call them phases if you're down in, or not down, across in WA. If you're in Queensland, they refer to them as stages or steps. If you're in Victoria, they're different steps to the steps that are in this plan here as well. And so there are variations on what's actually going on. It doesn't really, when I say it doesn't matter how your COVID plan refers to things, we found it a much easier process of keeping it to a 3-step process. And if it varies outside those or between it, then essentially you can ramp these up. Now, the COVID Safe legal compliance obligations means that you must look at having the key requirements met within your agency. And it looks at controlling the processes that you have. So looking at substitution, isolation, administration. So where can I substitute things like how we do our current business? So for example, enabling people to work from home where it can be done. Isolation means managing the social distancing or providing barriers. And you would have seen this in, say, Coles or Woolworths around the country as well, and Bunnings stores, etc. And also administrative changes in terms of providing training and supervision and instructions on how to manage COVID-19 within the workplace. So essentially, when we refer to these terms throughout this webinar today, you'll know, and you can always go back and have a look at these slides of what we're talking about here. So essentially, as duties of directors and officers, I cannot stress this enough, that you need to review your business policies and procedures to ensure that it meets the adequate risks of COVID-19, and you can update and use our materials as you need to. Some of the underlying principles that still apply, whether you're in a hotspot or not, is that you need to look at maintaining 1.5 distancing and good hygiene, staying home if unwell, frequently cleaning and disinfecting communal areas, and also having your COVID safe plan up for your workplaces and premises as well. Now, when we look at the COVID safe plan of what it actually looks like, we've adopted basically a quality standards framework. And what this gives you is essentially the compliance aspect, looking at the self-assessment, and then looking at the areas for improvement. And the self-assessment is looking at, well, what gaps do we have within our agency, identifying those areas for improvement, and that feeds into your COVID safe plan. And what we'll show you is what an agency has actually done, especially now during a hotspot, where they simply just ramped it right up and said, right, all staff are undertaking screenings and continuing to screen, and we'll actually ensure that our staff are safe during this period of time. So essentially, any gaps that they've been able to identify, they've done it incredibly quickly. And by taking this quality view of it, meant that they're essentially looking at self-assessments, identifying where the gaps are, changing it, reviewing it, and then it all starts again. And this is a screenshot that we've taken from the QIP, Quality Improvement Standards Audit Agency, and it's an adoption of it. And we do recognize their work around this as well too, particularly in the quality self-assessment process and guidelines that you can see there. So let's have a look. So with it, what we have done and what's important within your COVID safe plan is to look at the legislative requirements, looking at Commonwealth directives, looking at what safe work say for your workplace to ensure what is being done is appropriate and safe. What are the requirements that your staff or volunteers also need to have, and what are their obligations is equally here. Once that is then compiled together, essentially that goes into the COVID safe plan documents, and you've all got access to this dashboard to start to use today. What it gives you is a self-assessment checklist to go, right, I can identify if I need to do policies. I can identify if I need to undertake certain checks. And it gives you that areas for improvement, and it feeds back into your COVID safe plan. So essentially you've got your legislation, you've got your policies, you've got your regulatory requirements, and you've got your standards. Now, some agencies have said to us, look, we're a smaller agency. Do we need to do all of these things here? Well, with it, we've nutted these down to about 40 different points. And those 40 different key points, so it's about 40, will give you, if you're a smaller agency, then you can say, right, yes, we've got this. Yes, we've got a policy in place. Or yes, I've done a audit check of my workplace. And that's what you may just need to do. And you may only need to do that once a week or once a fortnight around it, because not many people go into your office or workplace. Now compare that to another agency that people frequently go into the workplace each day. Well, in that case, you're just taking what we've got here, and I'm going to say ramping it up. So the frequency of it becomes more frequent because there's much more traffic going in. And so this checklist essentially gives you this process to bring these things together as well. The one down the bottom here that you can see on the left-hand side is the Victorian Pandemic Plan for the Victorian health sector. We've just put that there as a place, but that placeholder, but that can essentially be from your own state or territory as well too. And it's just an example of the plan that's there. What comes out of this is obviously the daily notifications coming out of your own state and territory as well too. So essentially there may be additional things that you may need to know about. But again, news feeds allows that to happen when we've actually set these out to agencies, and when we run these webinars literally once or twice a week, we'll give you the information that you also need to know about as well. So essentially on your Gemba dashboard, what you've got already is your compliance items. Now what we're going to look at is the self-assessment and the areas for improvement around this. Now, what we have also looked at and what agencies have used during this hotspot is essentially the 14-point items that the Commonwealth directions have provided. Now, what this means that you should undertake, and what the Commonwealth said a number of months ago, is that you should undertake a formal risk assessment process and apply certain controls that are there. And what we can see here is these are the 14 points that they've actually worked through. Now, as you go through discouraging carpooling, promoting good hygiene, modifying the roster, all these types of things is what your agency should already have in place. Equally, when you look at COVID-19 at the workplace, well, here is the checklist actually provided by Safe Work. And essentially, it's very clear on what items need to happen. Now, when we look at who is actually responsible and who is involved, then what you can see is that by taking the COVID plan and actually opening this up to your volunteers or staff means that you can then start to monitor what is actually happening across your agency. And very, very quickly, if things were to change, then by simply having your staff undertaking what we call a COVID-19 daily assessment, very, very rapidly gives you the surveillance tools to see, right, we know exactly what's going on, who is actually being affected, and what we need to do to address it. And I'll show you how this works around this, but these are all available on your dashboard. And what we can see is that it'll then update your relevant COVID safe plan as well. Now let's actually have a look at what Rumballara Aboriginal Cooperative has actually been doing, and we've got a test site around this as well. Rumballara is an Aboriginal community-controlled organisation that is based in Shepparton, which is located right in the middle of the hotspot of what's going on. Essentially, they've got their staff training, which they can inform people about. They've got their notice board of information to send out alerts. They've got their policies of what's being done. They've got their pandemic plan right in the middle. And they've also got their pandemic forms, which help them notify and keep up to date of how many staff and who has been affected and who is safe as well too. And this is the way they've managed it as well. And they've got a whole list of policy documents that they've actually drafted up some time ago across each of these 9 areas. And that's some of the works that we've also helped them achieve that. Now let's actually have a look at how they've done this and some of the forms that they've actually used, which is just a very, very simple process to actually undertake it. And let me just go back to one slide. And if we log in to the dashboard, and you'll get your own login today as well too, you can simply go to our website, log in. This is our test login or demo login page. And once you log in, you'll see your own dashboard. And within here, essentially what you've got is your disaster system and your COVID safe plan. So you can click on the disaster module. You've got your projects area, and under this, you've got your COVID safe plan. And this essentially is our step-by-step guide of what you need to do and when. It'll send you out the reminders of what needs to happen, and each one of these items that you can see here is linked back to our plans and items that I've shown you in the previous session. And it essentially gives you that checklist tool of exactly what you need to do and when. And you've got a single seat that you can actually use to access this, and it's that simple. Some agencies have already been audited by the Department of Health and Human Services, and they've been asked for their workplace COVID plan. And quite simply, what they've done is go to this button here and actually printed it off and literally sent it out to them. And this comes out in a PDF document here. Here it is here. And it is that quick to generate your COVID safe plan as well. And it is as easy as that. Now, one of the things that agencies have done, especially Rumballara, is actually look at Right, we need to ensure that our staff are kept safe. Now, how can we actually do that? Well, they've got their COVID daily assessment form. And if I click on that, what comes up is that they essentially ask staff to go in. It's got the name of the person. I'm just logged in as Fred Flintstone, the date and the time that they've actually got it. And there's a series of questions that they actually need to answer. These include the epidemiological questions that the department actually sent out. Now, they've made a slight difference to their form. What they have done is actually look at, well, what are the areas, what are the hotspots that have been identified by the department? Now, right at the start of this webinar, I pointed out that there were some local hotspot areas. There were cafes, there was shopping centres, there was certain retail outlets as well too. And they actually listed those particular venues here in the form as well too. Recently, they've also taken one step further in actually asking staff, have you had a COVID test done as well too? And staff are volunteering this information to them as well. What was the date that you've actually had it done? Was it negative or positive as well too? And so part of that screening was to ensure that their staff are kept safe, but also because they provide a broad range of services to elders and aged care services, to justice services, medical services, children, youth and family services. So there's a lot of vulnerable, I'm going to say, populations within their vulnerable population group. But what this allows them to do is very, very quickly screen on a daily basis how their staff are actually traveling. I will add that to their recognition, they've also added in an EAP question around how is staff actually feeling to manage and support their mental health and well-being, which is actually a really important aspect to the support that you provide to staff and something that is often overlooked. In doing that, they've then got their working from home forms as well too. So while staff are actually even working remotely, they can also support staff and also manage their workloads from here as well. And all of this is being fed back to their COVID safe plan. So essentially the systems that they've got, and when we talk about ramping up, they've ramped up, and by saying to everybody, right, look everybody, we've actually got a notification, and they've got some people here, COVID safe update, and we're going to request everyone work from home due to hotspot. Okay, and if we post that out, then essentially what comes up is that it gets posted onto the notice board, and immediately everybody gets notified by email while they're on here as well. And so they can actually communicate directly with staff and keep up to date with what's going on out there while actually working from home. It means that as staff are working remotely, as they even now return back to work, especially in some of the medical areas and high risk areas and essential workers areas as well, then frontline workers, should I say, then essentially they've got their screening that's there, and they can actually go back for months and months and months because they've been doing the daily screening. And by staff volunteering this information, there's now a sense of community across it that this is what you do on a daily basis as things come up. Unique to them, they've also got what we call the pandemic assistance form as well too, where that way if they needed to send out food packs to people as well too to support them, then they can do that via this registration form as well. And they can actually see who's actually requested it and what supplies and information they need. So you can see very, very quickly by engaging staff, however big or small your agency is, whether they're staff or volunteers as well too. There are some agencies like migrant resource centres that have 120 odd volunteers and, you know, a handful of staff. But again, by actually opening this up, you can see that you're actually able to support a lot more people, and actually your COVID plan is actually working across your agency. And by getting this traction, you're meeting your legal compliance obligations by ensuring that your work workplace is kept safe, that your staff and or volunteers and personnel are equally kept safe, and you've got your information on the dashboard. Now, the other part that we've also listed here as well too is things like your cleaning registers. So if there is a hotspot area, what's your management and ability to manage your work health and safety in terms of your workplaces? Well, you need your cleaning registers as well. And that information is then placed here. And I'll also compare this to Women's Housing Limited as well too. Women's Housing Limited isn't actually in a hotspot, but they've undertaken a similar approach. Now, what's happened here is that should it actually occur, then they've already got the system in place to manage this process. And equally, they've updated their website and provided information for clients to see. So as part of the recommendations, what we make for yourselves is that when enacting your COVID safe disaster plan, you need to have your plan, your policy, support letters from staff ready to go. So if people need to travel out, they're able to do that. You've got your pandemic forms to allow that monitoring and surveillance to support your personnel. And the monitoring side of this, I cannot stress enough, is actually an important part in order to meet your legal compliance obligations. Now, I'm seeing this from my background in preventive medicine and also epidemiology and also practicing lawyer. So when I see these changes from my background, especially in epidemiology around disease control, you need to have the data of your own internal agency to support this. So by aligning your policies and disaster activities with industry plans and Commonwealth and state guidelines, will give you this information that you have. Now, you can access your COVID safe dashboard today and work on this by getting access for a representative from your agency. We have opened this up for all agencies joining us today as well too, and you have access to a single seat to allow this to happen as well too. And this is specifically around your COVID safe plan. In addition to that, there are a range of policies that your agency should have in place in order to manage going from zero to hotspot very, very quickly. And we've included as part of this managing the psychosocial risks for workers as well, which is something that is often overlooked. We will be circulating all of these slides and recordings out to agencies that have joined us today. If you do have any questions, we will open up the phone lines now. I will end this by saying thank you very much for joining us. If you are watching this webinar after today's live session, if you do have any questions, by all means, please contact us on 1300 360 360 or email us at support@gemba360.com.